It's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. Cases of monkeypox across the globe have seen a rapid increase. According to the U.S. CDC, more than 12,500 cases have been confirmed in 68 countries. Many countries, in response, have been ramping up their supply of vaccines to fight the virus. However, some health experts are saying it's too late to respond now.
Is that really true, and are we facing another potential global health crisis? For more, we have Michael Toole, a professor at Burnet Institute, joining us from Australia with us today. Good morning, Professor Toole. It's lovely to see you again.
Good morning from a very cold Melbourne.
Wow, well, it's very hot here in Seoul. And, well, my first question to you, Professor. Well, first of all, health officials globally, they're saying that the confirmed cases that we're seeing right now are just the tip of the iceberg. So that's really worrying, but also vague. So could you elaborate on what the officials are really saying by this in terms of what the situation is now or how it might possibly unfold?
Yes, so first of all, official cases are still rising, particularly in Europe and North America. But 68 countries around the world, including South Korea, have reported cases. Now, this may be an underestimate for a couple of reasons. Like any infectious disease, the symptoms vary from mild to very severe. And in those cases that are mild, the symptoms may just be fever and headache, like a viral illness. And those people may not notice a rash. Now, the other reason, which may be the main reason, is that around 95% of cases of monkeypox outside of Africa have been men who have sex with men. Now, this is not a sexually transmitted disease, but of course, in intimate relationships, there is skin-to-skin contact, and that is how the virus is spread. Now, there may be some people, men mainly, who may be afraid to reveal that they have the disease, and they may fear discrimination, just like in the early days of the HIV pandemic, when there was a lot of discrimination against men who have sex with men. So they're the two main reasons.
Right, and the WHO is considering calling the outbreak a global health threat. People are already weary from the prolonged COVID-19 pandemic. Is this move by the WHO necessary, and what are the implications if this is to happen?
Yes, so the WHO Expert Committee on Monkeypox will meet on Thursday. I can't second guess their decision, but they will probably be looking at the impact of this outbreak on health systems. And because monkeypox is, this strain of monkeypox is quite mild, there have been very few people in hospital. So unlike COVID, it's not likely so far to disrupt health systems, particularly as most cases are in wealthy countries. But on the other hand, if cases continue to increase, the spread may be even wider, and it may affect more low-income countries. That hasn't happened, but a case has been reported in India. So they'll be balancing up those different issues. If there is a declaration of a health emergency of global concern, that will free up resources to those countries that are struggling or might struggle in the future to obtain vaccines and to have good surveillance and contact tracing, because those three things are the main weapons we have against monkeypox: good surveillance, contact tracing, and what we call ring vaccination. So that's vaccination of contacts. It's very unlikely there will be population vaccination campaigns.
And of course, what is of global concern right now, Professor Toole, is the resurgence of COVID-19 cases that we're seeing due to the more transmissible variants such as BA4 and BA5. And well, we've really been dreading this kind of situation. And well, how are global authorities preparing to respond to this?
To COVID or to monkeypox?
To
COVID. I think the tools that we have to prevent the spread of COVID have not changed, except that we now have, at least in wealthy countries, access to vaccines. And vaccines are still the number one tool that we have. And it's very important that people get their third dose booster, and for those who are eligible, their fourth dose. That will certainly reduce the chance of you getting severe illness and ending up in hospital and or dying. Now, in addition, we know that masks work. Indoor mask wearing is very protective. At a population level, around 70% effective in reducing transmission, so long as they are good quality masks. The other issue that we haven't addressed in many countries is improving indoor ventilation. And this is a medium to long-term measure that I think every country in the world has to address. And that means, first of all, improving ventilation in hospitals, schools, and that's a government responsibility, but also businesses, bars, retail stores, gyms. These all need to improve their ventilation, and that will be the most effective long-term measure to prevent the spread of respiratory viruses. And let's keep in mind that there may be new, more severe variants of COVID, and after that, there may be a new pandemic virus. So we need to think about the immediate response and the longer term prevention and preparedness measures.
That's right, Professor Toole. Also, tying to what you have just explained to us about COVID, monkeypox, as you said, this particular strain is not as dangerous, so you're not particularly worried. But what we learned from this COVID-19 pandemic is that the virus evolves, right? So monkeypox virus could also evolve to be more transmissible or even more dangerous to certain patients. Is that a possibility that the global society need to sort of embrace the possibility for?
Absolutely. There are several strains of monkeypox. The most severe is in Central Africa. This outbreak came from West Africa, where there are 3 different strains. Now, Portugal's National Institute of Health, which was the first Western institute to isolate this virus, has found there's been a massive mutation since 2019, when there was an outbreak in Nigeria. Now, fortunately, it's the milder version, but it spreads more easily. Now, this institute estimates that in those 3 years since 2019, there have been 12 times as many mutations as you would expect. Normally 1 or 2 mutations a year, but now it's 50 mutations in 3 years. Now, that process, fortunately, it's mild. There've only been 3 deaths reported since early May, and those 3 were all in Western Africa. So there've been no deaths outside. But if it does become more severe, that will, of course, like COVID, mean a greater stress on our health system, particularly hospitals. The treatment for monkeypox is basically symptomatic. You treat the pain. But in severe cases, you may need to give antivirals, and that needs hospital care.
I see, Professor. Unfortunately, we're out of time, so this is where we'll have to leave the conversation. But thank you so much. It's an honour always speaking with you, and keep warm in Melbourne.
Okay, thanks.
Thank you.
Bye-bye.